One of the greatest moments in someone's life is having a baby, and then the supports that you receive during that journey. But oftentimes for young people that are coming out of the child welfare system themselves, or just don't have good family supports, they lack availability to someone that can help them and encourage them and support them during that time.
My guess, because I don't always know what life looks like for them, is that someone who has just aged out of foster care, who may be parenting or pregnant, is that they're feeling pretty lost. They don't have a lot of support from family or professionals because they've just aged out, and so now they have no one who's required to be in their corner.
I really didn't have that many supports around me at that time. I wasn't speaking to my mom. My foster mom I hadn't spoke to in years, so I was like, I'm not going to speak to her. It's nearly impossible to not start from the bottom.
What we've seen through data, what we've seen through lived experiences of the young people that have continued this cycle of working in the child welfare system is just the continued reoccurrence of staying within that cycle, whether it be poverty, abuse, lack of resources, those kinds of obstacles that just don't seem to get any better, but actually get bigger.
When young people face roadblocks in life, they often lead to larger crisis. So, for example, if young people aren't able to pay their rent, that often leads to them facing eviction. So if we can intervene early on and help mitigate that risk, then that will lead to better outcomes for the young people in the long term.
Some of the challenges that we see young people facing in our area are access to safe and affordable housing. We call it the 3 A's: affordability, availability, and age. It can be difficult for a young person to access resources, whether it be time or transportation, availability. The typical business hours that we're so accustomed to are often impossible for a young person to make fit in their schedule. And so what we try to do is reduce those barriers and not only advocating for the young person, but also holding their hand as they access those resources as well.
They were the only people that I knew that would be unconditional with their support, no matter how far I fell, no matter where I was at, and that they would help me through it.
We have a couple different categories that I kind of start with when I meet a young person for the first time. We go down the basics: housing, transportation, education, employment, financial literacy and financial management for themselves, general physical and mental health, and then I kind of say, and what do you want your life to look like? What are your own goals for 5 or 10 years down the road? There's probably a resource we can access to help them get there.
So we offer central navigation, access to resources and supports, connecting them. We offer flex funds as well, where we support them with some financial needs. We offer coaching, offering that mentor, that one-on-one resource. And then we also offer youth leadership, which is peer-to-peer support. Because of the funding that we were able to obtain and offer into our area, we were able to build on partnerships that were already established in our community. So working with transportation to be able to make sure that young people are able to not only take their children to childcare, but also to continue going to school, to continue and finish their education, to going to work, to getting to medical appointments, those kinds of things. Other partnerships also include parent education and coaching, which is beneficial for everyone regardless of age, but especially beneficial for young people that can also build peer-to-peer supports.
A girl that I'm working with right now, she's a success story and a future success story too, because we're definitely still in the trenches of some of this stuff. I've seen her she's been able to get her GED. She's been able to secure childcare for her daughter so that she can job search. She's definitely hireable. We're just still working on that consistency for her when she is able to get a job. And I think it's been a success because she's been able to see in herself then that she can achieve something like her education, and she wants to go further with that. So she's becoming more confident in her own abilities to make something for herself.
Prevention work isn't important just for the families that are touched by it, but it's also important for our communities and for our state. Economically, we see the return in investment when we work with families firsthand and avoiding some of the big cost issues that often affect those families. So it really is a turn in investment, not only economically, but also for the families that are affected and provided resources with. I think to build a stronger community, you need to have that collaboration, that partnership, and that eagerness to have those difficult conversations on what your community, what your state is lacking still, and what you can do to help better it, whether it be financially, whether it be partnering, advocating, that whole collaborative. We can't do it alone. It needs to be a collaboration across the state, across our communities. Everyone should be involved.
Things are just starting to line up, and I'm starting to see like the light at the end of the tunnel, you know, like forming my family and forming a future. And I know that I can guide myself to the way that I want to go, to the life that I want to lead. And I want a successful, stable, happy family life.